Hello, everybody. We were just chatting on the side chat about travel. Rena just flew back from Florida. I've actually not flown in a year. I'm rethinking and giving up all my Delta status and everything else. I used to fly about twice a month for years, but I'm not doing that now. And anyway, so the issue comes up about obviously safety of flying and people around you. And there's been some articles written, how do you know the person next to you doesn't have COVID? Because there's so much asymptomatic transmission potentially. So anyways, in late November, early December, I had COVID for about an hour. It was a terrible hour. And I don't make light of it because people have gotten very sick and people have died. I was very lucky. I lost smell for a couple of days. And that was the beginning and that was the end, but it was enough. It was so strange not to be able to smell garlic. And I don't expect anybody to give you any sympathy for that. I just mean it was strange not to have smell. It wasn't painful and it wasn't delusional. It was just strange. So I did get tested, swabbed, and then I had my antibody test about 6 weeks ago, and it was very strongly present antibodies. So there is a little controversy right now. There's two papers in the last month. One that reports if you have antibodies from a COVID infection, presumably symptomatic infection, maybe truly maybe asymptomatic, and you just happen to get an antibody test, you may have 6 months protection. Or another study from about 3 weeks ago says you may have 8 months protection. And a study sort of referenced in Forbes magazine, not your usual medical journal, said it may actually persist for several years. We haven't had COVID long enough to say that definitively, of course. So there is some controversy. I urge anybody and everybody, there's a Johns Hopkins professor of surgery, but he has a MD, he has an MPH. He writes articles and books. I've had a chance to be on national TV with him, Marty McCary, M-A-K-A-R-Y, MD, MPH. Book last year called The Price We Pay. Absolutely phenomenal book about medical economics and how we're getting drowned in our hospital bills and how we can get out of them and never have them. But he's been writing lately, for example, medical community, if you've had COVID and you're younger than 70, why are you rushing to get the vaccine when there are 70 and 80-year-olds in nursing homes and with diabetes and heart disease that can't get a vaccine because of access? Why are you sopping up a shot right now? Or why are you a 25-year-old school worker who is taking a vaccine when a 75-year-old grandparent can't find a vaccine? And then that was about 2 weeks ago, and it's provocative, but he's got the street cred to say stuff like that. And it's not political. He's talking very medically and very much from a public health standpoint. And lately he's been talking about if you've had the COVID antibody, maybe take one vaccine. You already have an immune system revved up. All you got to do is give it a little boost, theoretically. Not too many people are actually saying the same thing he is. Not too many people are studying it. It's all, everything about COVID is new. I think he's right, personally. I think if you clearly had COVID and you have antibodies and you really want a vaccine, get one. Or I'm going to wait till the Johnson & Johnson one presumably is out, which is a single dose. There have been a few people not die, but get quite sick with the second dose of their Moderna or Johnson & Johnson in the presence of prior antibodies. They probably, have a pretty active immune system. And after the first dose, they got a real active immune system. And the second dose may be just frankly overdone. Now, again, this is discussion. We don't know for sure. But anyway, so as you travel from Florida to California, you were being cautious. I'm going to be cautious when I travel, maybe later this month to take my mother to Florida to drop her off for a few months, but a little less concerned because antibodies do seem to give protection, whether they're natural antibodies or vaccine-induced antibodies. So that's the comment. Welcome back from Florida.
Thank you. And I'm going to stay quarantined for, I think, 7 days. I was told that I can go ahead and get tested. Dr. Jill, what are your thoughts on if I got vaccinated, if I got tested in order to determine if I was going to be positive at all or not?
Yeah, you'd wait till, if you got back yesterday, you'd probably wait till Thursday or Friday. If you were swabbed and negative, I wouldn't continue quarantining yourself.
Okay, so you're saying within 24 to 48 hours I can get tested?
Yeah, today's Monday, maybe, Thursday. It's not even 24 hours, so it may not be enough time for you to, necessarily have detectable growth of the virus in your nasal passageways. So
Okay.
I'd wait a little bit. Or you can go to China. You know what they're doing in China?
No.
This is just a joke. Please don't get mad at me, but it has. They've developed a rectal COVID swab. They say it's
I heard that.
So,
Why
I mean,
is that?
it's been in the news. I can't verify it. There's so much talk, but I would suggest you do the nasal one.
I think so. So why do you think rectal? What's
All I know is engendered a lot of jokes about wearing 3 pair of underwear. Virus in the body is virus in the body, and I don't know why it's not a cheek swab, why it has to be a nose swab. There may be more, I don't want to say it wrong if it's the word receptors for the spike in the nose. There was some of that early talk when we first heard the word COVID that the nose and whether you're on blood pressure medicine or not, almost everything about the blood pressure medicine concern has blown over. Is it good? Is it bad? But, I think there are more access points for the virus, and it's more humid and more secluded in the nose for virus to replicate. Now, don't want to make any analogies to the rectal swab in the nose, but perhaps it has the same life cycle.
Got it. Okay, well, let's dive into, thank you for sharing that. And let's dive into today's set of questions. I have the first question on atrial fibrillation.
Love it.
Are there any alternative, safer, effective treatments or protocols that can be used beside the standard pharmaceuticals that are being used?
Well, that's an hour and a half of discussion because the standard pharmaceuticals have different purposes. Some people develop atrial fibrillation, have no symptoms, and their heart rate's 80. And it's not that uncommon. You're going in for a colonoscopy, nurse checks your pulse, it's irregular, they get an EKG, it's atrial fibrillation, and you had no symptoms, and you have no idea when it started. This actually happens quite a bit. But many people do know, darn, I'm back in AFib, I can feel it, and my heart's 130. So one purpose of pharmacology is to slow an excessively fast heart rate. That is common, but not absolutely mandatory in atrial fibrillation, right when it develops or even long-term. Things like beta blockers, things like calcium blockers, pretty rarely digoxin. We used to use that a lot, but not so much anymore. There's not much natural. There's in the vitamin world, supplement world, herbal world, homeopathic world that's going to slow the heart rate. Breathing techniques are wonderful. And, if you want to hold your breath, you might slow the heart rate. But the minute you start breathing again, it's not going to be the same increased vagal tone. So the answer to that, we use beta blockers predominantly, metoprolol, toprol, Lobrusser. Sometimes we use calcium blockers like cardizem or verapamil. And there really isn't much of a natural substitute. And very honestly, for most people, short-term heart rate slowing medication when atrial fibrillation is going fast is very reasonable and very safe too. So there really isn't a substitute there. The second goal is blood thinning. And if it's a very short episode, half an hour, some people know when they're in, they know when it goes away, or maybe they have an Apple 5 watch, or they have a little heart monitor called a Cardia, Kardia, and they can track. I was in atrial fibrillation for 38 minutes Friday, Dr. Kahn. We don't think you're at much stroke risk for 20, 30 minutes of atrial fibrillation. You probably don't have enough time for a blood clot to form if it really was a short, quick in and out. If you have a lot of short, quick in and outs, we don't really have much data on that. It might be risk. We think you need to be in atrial fibrillation for a day or two, and you might run the risk if you have an abnormal heart or abnormal physiology like diabetes or heart failure. You might be at risk for clot that could break loose, cause a stroke. So we use heparin if you're in the emergency room, intravenous, or in the hospital. In the office, we use the old-fashioned warfarin. We don't like it. We don't use it much anymore. And we use the newer drugs that are about 11 years old now, like Pradaxa, Xarelto. In the short-term setting, again, unfortunately, there's not much in the natural world that helps thin the blood. Yes, of course, vitamin E, fish oil. Some people are familiar with enzymes called nattokinase, lumbrokinase. On the one hand, you're dealing with atrial fibrillation and a real risk of stroke. The older you are, female more than male, high blood pressure over people with normal blood pressure, people with prior stroke. It can be devastating to be in atrial fibrillation and have a clot and a stroke. On the other hand, we have no data other than theoretically for using some of these natural agents to thin the blood, as opposed to absolutely massive data for the prescription drugs. Trials with thousands and thousands and thousands of patients and FDA oversight. And of course, mishaps happen, but there's no doubt if your choice was to be on twice a day or warfarin, not frequently used anymore, or taking natural, much, much better stroke prevention with Eliquis. Easier to use, no blood tests. Of course, if you cut your finger, you're going to bleed. You're going to bleed on any of these agents. That's the purpose, is to thin the blood. So, there's not much to offer there if you believe you should ground your advice in science. And if you really respect the fact that strokes are horrible, they can be fatal. And there are people that, have made the wrong decision or delayed or stopped their medicine and, stroke ensued, and very, very tragic. So I'm absolutely, inflexible about recommending. Doesn't mean everybody listens.
Right.
And maybe to put it in perspective, in studies that have been done, if you're in fibrillation all the time, which there's a lot of people, every day, all the time, never goes away, an average person might be at risk 5 or 6% per year risk of stroke. Meaning most years, you're 95% likely not to have a stroke. Of course, if you have that medical condition for 10 years, that could theoretically get to a 50-50 chance of stroke, which is pretty high. But if you're talking one day, Doc, I was in atrial fibrillation last Thursday, and I toughed it out, and it's gone. And I didn't take that Eliquis you gave me, because I will sometimes give people, it's called pill in pocket. Don't use these medicines every day because you're not in fibrillation today, and you haven't been in fibrillation all month, because we check with our Apple Watch or our Cardia or heart monitors, even your blood pressure cuff. I ask people all the time, do you have a home blood pressure cuff? And the answer has to be yes in my clinic. If you don't, you're buying one today from my clinic. Just sell them the same price. You can buy them anywhere. Number two, do you notice the heart rate when you take your blood pressure? It's amazing how many people don't know. There's a little pulse recording there underneath blood pressure. And if you know your heart rate's normally 64, and for a few times in a row you're checking and it's 98, something's amiss, and it may well be fibrillation. So there's all kinds of clues. But if you're in fibrillation, for 6 hours, when the risk per year is 5 or 6%, could be even a little higher in some people. It's not a very ominous number. It's really more if it persists and persists. So again, sadly, the natural approach to atrial fibrillation doesn't have much science to offer for blood thinning. The last one is you want to get rid of your fibrillation if you can. That may require an electrical shock to the heart in the hospital or outpatient setting called a cardioversion. You have to do that with blood thinners around. Might be some prescription drugs that are antiarrhythmics. They're supposed to return the heart to normal. And there's just, again, not much. Now, if I have a patient with fibrillation, I like them on CoQ10, I like them on magnesium, sometimes you use taurine. What other ones, might come up? Berberine, sharp patient of mine's in a Facebook AFib users group. And berberine is a natural alkaloid used for its antibiotic properties, blood sugar properties, blood pressure properties, but there's very little data, but a touch of data, it may help prevent future atrial fibrillation. But I like people on those things, but you can't throw your prescription pad away because, again, you're dealing with stroke risk, and you never know how big or how bad or how dense or how even, life-threatening a stroke can be, so you just don't want one. I'm neurotic about blood thinners and fibrillation. Not everybody needs it. I mean, if you're 54 years old and you don't have high blood pressure, you don't have diabetes, and you have never had a stroke or a TIA, never had a heart failure, you're at very low risk for a stroke if you have atrial fibrillation. But usually it's quite a different patient subset where they do have a lot of other diseases that we know put them at risk. So just say no to stroke.
Love it. Absolutely. I'd like to see if there's a follow-up question on that from the audience. If you do have a question for Dr. Joel, please click on the chat icon at the bottom and go ahead and type it in. And you actually can choose to send it to me directly. So you can say reply privately, select me, and then if there's additional questions, we'll go into that. So another question that came in was, what does my family history have to do with my risk of getting heart disease? What should I be worried about?
Yeah.
Oh, Dr. Joel, sorry, before we jump into that, on the previous,
right.
There's a follow-up question, which is, what is the cause of atrial fibrillation?
Yeah, as people may know, a lot of medicine, we call it the differential diagnosis. And you just run through a list. And if you want to be exhaustive, you go search it or open a textbook. But common things are common. So when you talk about atrial fibrillation, the number one underlying cause that structurally it changes the heart, it scars the heart, it ages the heart, is high blood pressure. So if you've had high blood pressure, and particularly if it's poorly controlled or undiagnosed, because it can be completely asymptomatic, you can get scarring in the heart, enlargement of the heart, thickening of the heart, and fibrillation can follow. Now, that's not a process of a few days. That's a process of months to years. That's why, again, everybody needs to have a home digital blood pressure cuff on their upper arm, and they need to make it as simple as possible. Unfortunately, I took off. I ordered on a GoFundMe thing I saw on the web, a watch, very attractive watch, but it's a blood pressure watch. And I'm still playing with it. The band actually inflates, presses my wrist, reports my blood pressure. I do it when I'm driving. I do it when I'm standing in the grocery store. I do it when I'm seeing patients, because all you got to do is have your wrist level and quiet, and in about 40 seconds, you get your blood pressure. Something like that is badly needed. I'm not sure this is the solution. It's from deep, deep in China, and every time I have a technical question, it takes me a few days to get somebody to answer an email. It's not like it's widely available. It wasn't terribly expensive, maybe about $250, but we need better ways. But in the meantime, it doesn't do any good to buy a blood pressure cuff, put it in the box, and forget where it is. You got to leave it out on a coffee table and have some habit of checking blood pressure. So that's number one. But I talk about blood pressure all the time. I think it is the least checked, most important vital sign. And we ignore the fact that we're running 150, 155, 160. All those are quite abnormal. 140 is abnormal. And, 5 years later, you might be in atrial fibrillation, or 3 years later. And number two is binging on alcohol. Last night was the Super Bowl. A lot of Michelob Ultra ads, even some Zero Bud Light ads. Because Zero Bud Light is no alcohol. That won't put you in fibrillation. But, people that were partying and had 5, 6 Manhattans or 6, 7 beers or a glass of wine, acute alcohol intoxication, even if you're not drunk, just what it does to your heart. We're learning more and more. Unfortunately, there's a lot of health advantages. Rena lives in the middle of wine country. There's a lot of health advantages to alcohol in modest intake, but there are some downsides, and fibrillation is growing as a problem, particularly, and unfortunately, if you've had fibrillation and you keep on enjoying one or two cocktails, it can seemingly play a big role in whether you're going to get another episode of fibrillation. So we have to really tell our fibbers to be near teetotalers. One drink might be okay. 4 drinks might put you back to fibrillation. Valve problems, not very common. Used to be more common when rheumatic heart disease 100 years ago, but there are still people with leaky valves, clogged valves, scarred valves. A prior heart attack that distorts the heart causes what's called congestive heart failure. These are causes. Thyroid, but the most common thyroid condition is low thyroid, hypo. Atrial fibrillation rarely occurs with that. It occurs with overactive thyroid or Graves' disease, and that's just not that common. And when you treat the thyroid disease, the fibrillation will usually go away for good. Sleep apnea is a big one. Sleep. I spend as much time talking about high blood pressure in the office as I do talking about sleep. Snoring, mouth breathing, dry mouth at night, apnea at night are all triggers of fibrillation. Home sleep studies are easier and easier. My clinic in Detroit, we do home sleep studies every day on people. It's like a wrapper watch you wear at night. It records oxygen, skin temperature, all kinds of other parameters, and you get a full sleep report without having to go to an office building or a hospital, and about a fraction of the cost. Very good breakthrough. Some people use an app called Snore Lab, SNORE Lab, which records your noises at night from your smartphone and gives you an analysis in the morning. It's not a full sleep study, but it's a little pre-screen. That's a free app. I lately have been, I don't know if this prevents fibrillation. I've always been asking people questions about their sleep. And lately I've been asking them, do you have a dry mouth at night? Do you think you sleep with your mouth open, which is not the healthiest arrangement? You're supposed to be breathing through your nose at night, but a lot of people don't. I actually have a lot of people taping their mouth shut at night with special medical tape called micropore tape, 3M micropore tape. They sleep better, they stop snoring, they stop gasping, they stop getting up at night to pee, and they love me for suggesting the weirdest thing I've ever suggested to people, which is tape their mouth shut. There's a zillion books to read. There's a book on the New York Times bestseller list. There's a book called Breath on the New York Times bestseller list right now by James Nestor. Goes through this in detail. About 5 years ago, there was a book very successful called The Oxygen Advantage by an Irishman, Patrick McCowan. Goes through it. There's a hashtag on Instagram, hashtag tape it shut, and you can see all kinds of people taping their mouth shut at night. And it's amazing because about 2 or 3 days later, I get an email. That was weird, but I didn't get up once. I didn't move. My partner said I didn't make noise, and I feel refreshed. And not if you have full-blown sleep apnea. If you have full-blown sleep apnea, you need a full sleep study. You might need the whole apparatus. But I've done a few hundred sleep studies in my clinic, and 95% of them come back mild. And mild, you don't get all the equipment. You don't qualify for it by insurance criteria. So, there hasn't been much in the past other than tell people to lose weight, which helps. Now I can tell them to lose weight. And if they take their mouth shut at night and during the day, they won't snore at night and they won't eat as much during the day. Now, I don't tell them to tape their mouth shut during the day, but there actually are people that know, like they're on Zoom calls, just listening, or they're doing some paperwork because everybody's working from home now, and they just know their mouth breathers. There actually are people that it's just one, maybe 3.5-inch piece of tape from top across your lips. And they actually are taping their mouth during the day, and it forces you to breathe through your nose. And it just feels good. And, maybe a month or two later, you don't need to do it anymore because you've kind of trained yourself, at least when you're semi-awake. But so I do this myself. I tape my mouth shut at night now. Anyways, that goes back to fibrillation. It's bizarre, but it's actually science-backed. This book called Breath on the New York Times bestseller list by James Nestor. Fascinating book. Breath.
I'm actually online.
Yeah, other causes of atrial fibrillation, cocaine.
And I'm looking at the images and I'm thinking, boy, if I was a guy and I was taping my mouth shut, does it hurt when you pull it off?
Well, if you got facial hair, it can be an issue.
Yeah.
There is there's a brand of tape on Amazon called Somnifix,
Hmm.
Somnifix, and I guess the bearded people like that a little better. But it's almost a reason to, get rid of your facial hair to sleep better at night. It's so crucial. I mean, other causes of fibrillation, if you throw a pulmonary embolism, that can trigger it. That's pretty rare.
Mm-hmm.
But just think about blood pressure, too much booze, sleep. Those are the big three.
Got it. Got it. Okay, so then following on to the question of what is my family history, maybe my grandparents or who knows, great grandparents, my parents, what is the influence of that? Because I'm hearing about epigenetics and I want to understand what my true risk factor is.
Yeah. Heart disease isn't just one thing. Of course, the biggest and scariest is clogging arteries, having a heart attack, dropping dead, or clogging arteries, having a stroke and being disabled or dropping dead. Maybe there have been estimates that as much as 30% of those diseases is largely genetic. 70% is diet, fitness, sleep, smoking, the lifestyle issues. 30% is a big number. It's tens of thousands, if not hundreds of thousands of deaths a year in the United States. How do you know? Well, one, you got to take that careful family history. What mom alive, dad alive, brothers, sisters, grandparents. It's interesting to do that. It's interesting how many families have fractured structure. I don't know much about my mom. I haven't talked to her in 20 years. I mean, I always feel badly to get those kind of answers, but they come up frequently. Haven't talked to my brothers and sisters in a long time. It's just, there's a lot of trauma out there. It's sad. But if you can get the history, get the history. Largely it's, blood work. It's expensive, but it's available. So we've talked before about lipoprotein little a, my favorite cholesterol particle, 25% of all people. It's inherited from mom and dad. If you have a sky-high level, it could contribute to your heart disease, even if you're eating well, even if you're exercising, if you're not smoking. There's a gene called ApoE. You can do it in a blood test. Sometimes insurance will cover it. If you inherit something called ApoE4 from your mom and dad, particularly if you inherit from both of them, your risk of heart disease and Alzheimer's goes up a lot. Alzheimer's may be 20 times higher than the average public. Heart disease, not quite that much. There's a couple others. If you send away like a saliva test to 23andMe, where they don't measure genes, and others called your SNPs, little variations in your genetic material that we all have. We have, if I remember, 3 billion genes, about 10 million of them are these SNPs. You can't interpret these tests. You have to send them somewhere else and get a report and says, you're a little bit more risk for blood pressure, you're a little less risk for cancer, you're a little more risk for obesity, and read through them and maybe make some lifestyle changes based on the report. We're close, but we're not yet where everybody's really getting their entire genes checked and using it to guide our life. But anyways, it matters. And if you know that mom, dad, brother, sister, grandparents had a lot of colon cancer or fibrillation or early death from heart attacks, you'd be wise to see somebody who can handle some advanced evaluation, and you'd be wise to manage your lifestyle and overcome it. You can do a lot even if you've inherited some of this genetic input that we would call, increases your risk. It doesn't mean, other than a few diseases like Huntington's chorea, I think if you inherit that gene, you pretty much are destined to get that terrible neurodegenerative disease. But for most of them, heart disease, blood pressure, diabetes, these are so complex that inheriting the gene just puts you at more risk, but you just got to fight a little harder to get back to less risk.
Wow, okay. Dr. Joel, what are your thoughts around those that are dealing with a lot of high stress and that's showing up in their blood pressure readings, potentially cholesterol readings? What can everyone do, given we're still in the middle of a pandemic,
Yeah.
to really manage their stress, especially as it pertains to heart? Are there supplements, exercises, breathing? And I know you've shared this in the past,
Yeah.
but you've got some new members.
Yeah. Never gets old. And, I spend a lot of time talking to people, and that often is some of their biggest concerns. Can you help me with my stress? I mean, number one, in helping them with their sleep. I mean, don't deal with stress with booze or bags and bags of weed and Valium and Ativan. We try 10 different things to get people to sleep. You know, turn the lights off early, cold room, dark room, white noise, blue light blocking glasses. I usually have a pair hanging around here, but I don't see any right now. Meditation apps, meditation tapes. I recently came across an app. I think I deleted it. It was the most sleep-inducing music. Anyways, they wanted to charge $20 a month. Oh, it's called Can't Sleep. Interesting. Yeah, it was a science-based evaluation of music and sound to help you sleep. But there was a subscription, and I just didn't go for it. I just wanted to play with it. Can't Sleep app. A warm magnesium Epsom salt bath before bed. And then, unfortunately, meditation, yoga, don't drink coffee close to bed, don't drink wine or booze close to bed, don't work out close to bed, work out earlier, and don't eat a big meal late at night. And then, meditation apps, breathing apps are all key, but ultimately people are probably taking some pills. Melatonin, I use really low dose melatonin, like 0.3 or 0.6 milligram, and only use the higher doses really for the really hard to deal with people. Those are not normal physiology doses. Magnesium before bed. I love full spectrum hemp oil, that synchronicity product I post a lot about, because I just see so many people do well with it. I mean, they get so nervous when their bottle's empty and I don't have a replacement bottle because it's on order. What do you mean I can't get another, I don't want to go tonight and not sleep. So it's clearly helping people. Valerian, lavender essential oil. You can put a diffuser on your nightstand to get a nice relaxing approach. My new one is guava tea. It's reported that guava tea, you can buy the tea bags, organic guava tea is very sleep inducing. It doesn't taste like much. It tastes like I'm drinking hot water. There's a little hint of herbal flavor to it, but that was a new one for me. The hardest one is the people that wake up at 3 a.m. and have trouble falling back to sleep. The monkey mind, the active mind, that's what they call the yoga studio, the monkey mind. It's a toughie. The experts will tell you, get out of bed if you're awake for more than 20 minutes. Don't lie there in bed all night long, flip-flopping. Get out of bed, read quietly, maybe with some blue light blocking glasses, then go back in bed. Maybe make a cup of chamomile tea, something like that. Anyway, so that's just one thing for stress, anxiety, trying to get 7-8 hours of sleep. If you really want to be a professional sleeper, you got to get a sleep ring called Aura, O-U-R-A ring, or maybe a Whoop band of H-O-O-P. So if you can't track it, you really don't know how you're sleeping, because you want an hour to 2 of deep sleep and an hour or 2 of non-REM sleep. And there's just no way in the world to possibly know if you're not tracking it. So sleep, breathing, yoga, meditation, music, prayer, faith. There are some other things for anxiety specifically, and it can be so tough. Saffron has some data for anxiety, very exotic spice from India, of course. But I know of a product from Life Extension called Mood Improve. It's saffron with a probiotic. They have a few science studies, like take a Prozac or take saffron and you get as much improvement in your anxiety with saffron. I took all my devices off. I wear a lot of weird wearables on some days. But I use this device now called the Apollo Neuroband, APOLLO Neuro, NEURO.com. And it's a vibrating device that lowers stress. They've done actual human research at a very high level in PTSD and anxiety, and some children with emotional and traumatic upbringing. And there's some benefit to it. Gentle, quiet vibration on your wrist or on your ankle. You can wear it at night, you can wear it during the day. Pretty cool thing. And it's nice that it's science-based, and it's a device. It's not more pills, more pills, more pills all the time. That's, I've also played around with, if you really, really have trouble with anxiety, sometimes it's nice to get a clue that anxiety is building up before it, kind of strikes. And there's a measurement called heart rate variability. You breathe in, your heart speeds up. You breathe out, your heart slows down. But the changes are so subtle, you're not going to feel it. And the changes are so subtle that you're not going to be able, using your watch or your pulse, to really feel it. So there's a device I've been playing with for a few weeks. I don't think I'm going to keep using it long term. And I just took it off again. It's called getlief.com, GETLIEF.com. And you wear it as a patch over your heart, kind of like you were wearing an EKG patch. And it monitors your heart rate variability beat to beat very accurately. Everything's an app on the phone. You can watch that. But if your heart rate variability starts to drop, which is not good, it means stress is building, anxiety is building, your resilience is going down. It buzzes, so it actually gives you feedback. And I've kind of had to deal with this. I'm seeing a patient and my chest is buzzing. They can't hear it. I can feel it. But it encourages you to take 2-3 minutes of deep, slow breaths and kind of get your act together. And it's kind of like a little counselor, a little psychologist in a patch. So I've had a pretty interesting idea. I'm not sure I love everything about it. It's also a little big right now. It's the first generation. So just some things like that. Get ashwagandha, get rhodiola. These are adaptogenic herbs that aren't addictive and safe for anxiety. Might help.
Thank you so much, Dr. Joel. That's definitely a lot of good information that I think we all need to be following. Ashwagandha is something I swear by.
I love it.
Melatonin is something that is my best friend every night. I literally take 2 drops, not even 3. If I take 3, I get crazy nightmares, like really vivid
I
nightmares.
dreamt about Tom Brady last night, and no surprise.
Sorry?
I was dreaming about Tom Brady last night.
Were you dreaming about his insane diet? Let's talk 2 minutes about his diet and fitness regime. I don't know if you had a chance to look at or listen to the interview that came out on his fitness and food routine.
Well, I mean, I've been reading about it for years. I've got his book TB12 in my office. I mean, 80% plants, 20% generally organic, high quality, low fat meats and fish. He doesn't, during the season, he doesn't like to eat the deadly nightshades, the peppers, the eggplants. What are some of the deadly nightshades? Those are the 2 big ones. Because
it's also gluten-free.
Yeah, that maybe, maybe he tries to avoid inflammation and let his body heal back after getting beat up. Although he didn't get beat up all that bad last night. He was pretty well protected. I don't think it's crazy. I mean, proof of the pudding, it's working pretty well for him. He's not eating the classic 24-ounce steak before a game like most football players traditionally have been doing. And, he's got that lean, flexible physiology that just is allowing him to move quick. I don't think 43 is very old. I think you'd agree with that, Rena. But in his, for what he's doing, it's obviously old. So I think it's pretty cool. I mean,
what do you think about the fact that he doesn't take nightshades? I know you like your peppers and tomatoes.
Yeah.
So for the common person that's listening to that and wondering, first of all, what the heck's a nightshade? And second of all, is that something I should be wary of? What are your recommendations?
Yeah, I'm all for trying things if you've exhausted standard approaches and you're not getting a solution. So, I mean, if you have inflammation, whether it's rheumatoid arthritis or your joints are just sore, and you're eating healthy, whole food, plant-based forward diets. You're trying to manage your weight, manage your sleep. You're not abusing added sugar and chemicals, and you still got a lot of pain and inflammation. I mean, you say, okay, I'm going to take 2 months and not eat potatoes and not eat eggplant and not eat peppers and not eat tomatoes with seeds. Tobacco's a nightshade vegetable too, so I encourage you not to eat tobacco. But anyways, that's really the list: potatoes, peppers, eggplants, and tomatoes. I mean, what the heck? Go do that for a month. Go see if you feel tremendously better. There's certainly more anecdote than science. Didn't I post an article, I think today in Heal Circle, about anti-nutrients? And these would almost fit in that. And most anti-nutrients are actually nutrients, maybe with the exception, according to the article, of oxalates. If you eat a pound of spinach every day, you might indeed be a little worried about your risk of one day developing kidney stones, oxalate stones. But you hear about lectins, and you hear about phytic acid, and here we are talking about nightshades. Most of it's just nonsense. Yeah, I mean, and the fact that he's doing it doesn't make it scientifically proven. It's just interesting.
I second your comment about just give it a try. I had someone tell me last week that they had a family member, excuse me, that was struggling pretty dramatically with a lot of symptoms. And long and short of it is, it turned out to be quinoa. And she didn't realize that quinoa was creating such incredible disharmony in her body. And she gave it up after listening to some podcasts where they said, look, go on a circular, an elimination diet.
Right.
Which is more about, don't eat anything that you've eaten the last 30 days. Eat something completely different. And then try to isolate if it could be. And it turned out to be quinoa. So I think that's a great point, Dr. Joel. Someone who's got...
There are people that will do, grain-free, even if grain-free is things like quinoa. And again, I don't have any problem with people trying it for a short time. And, if they have a legitimate reason to do it, but certainly don't keep eating Hershey's Kisses and, eliminating nightshades. You want to go through and the obvious ones like dairy, and some people react to corn, some people react to wheat, and I would put nightshades pretty far down the list of foods that I eliminate, or all these anti-nutrients, in fact.
All right. Any other questions, folks? Please go ahead and post. Otherwise, I think my last question for you, Dr. Joel, is what are your big recommendations as we sort of start to look towards March, April, May, kind of the next 3 months? What are your heart healthy recommendations, one or two, that folks can really focus and implement?
Yeah, we haven't talked about it. I mean, exercising outside. Again, some of you live in environments where you can do that close to 12 months a year. A lot of us, although you can walk outside in Michigan in the winter, you better bundle up. And some people, it's just not safe. It's slippery. It's cold. It's not good for their cardiac condition. So, I mean, exercising outside, something that Japanese call forest bathing, maybe somewhat cleaner air than in your house or in the gym. Maybe just being around nature has some other spiritual benefits or energetic benefits we can't really measure so well. If there's a place you can walk around outside and barefoot safely, that's called grounding or earthing. It kind of combines a whole bunch of different things together that may help you and heal some inflammation. So get fit, but get fit outside if you can. What else would be a spring cleaning habit? Everybody, not everybody, we talk about some people did dry January. It might, Lent is starting Wednesday, 40 days might be a good time for a lot of people that accumulated a higher intake of booze during COVID, at home, bored, need some comfort. There's old Jack Daniels to help you. Whether you're a Catholic or not, it might not be a bad idea to go 40 days as a dry Lent and just participate in it. If you're not religious about it, at least enjoy some benefits. And then maybe gain the strength to go back to drinking, but a little bit more controlled and not excessive. That'd be a good one. And plant a garden in spring so that by midsummer, what better source of nutrition than walking in your backyard, pulling up some carrots, some peppers, some tomatoes, some maybe shallots and green onions, and doing that right in your backyard. That way you don't have to worry about organic labels.
Love that advice, Dr. Joel. Thank you so much. You're amazing as always.
Thank you, everybody. Everybody have a good evening. And I appreciate some excellent questions. Rena, let's chat soon, okay?
Absolutely. Take care, everyone. Stay smiling.
Bye-bye.